Welcome back. I want to turn now to a conversation between Yahoo Finance's health reporter Anjalee Khemlani and Andy Slavitt, a member of the White House COVID-19 team. Hi, Anjalee.
Hey, Kristen, thanks so much. And great to have you on again. Andy, I know it's been an interesting last few months for you, but we've, with the book that you've just published, Preventable, talking about the pandemic over 2020, we will get to that in just a second. But of course, today, the news of the day is the Supreme Court decision on the Affordable Care Act and the 7-2 upholding the act and the law. And I just want to start there with, you worked on this. This was the start of sort of your career in the Obama administration, and looking through what it's been through, the third time that it's had been challenged, and now standing still. Looks like what happened in this round was a focus on removing the penalty for the individual mandate and the resulting sort of burden on states for that. And the court clearly decided that they're not facing as much of a burden. But I want to look at it from your perspective on what that means for insurers moving forward and what this decision really says for the health industry.
Well, first of all, for Americans, this is great news. It says that the sword that's been hanging over their heads for so long, for the last decade, about whether their health care can be taken away from them, the pre-existing condition protection can be taken away, that Trump basically built much of his presidency around, is no longer a threat. And that's great news for people. The court basically said today, in effect, a conservative court by 7-2 margin said, in fact, get this out of our court. This has no place being here, so it couldn't be any stronger, and so that's very good news. And I think it will mean that more people will be on a path to getting coverage, more people on a path to getting insured. There's ample opportunity to improve the law, and for insurance companies, that obviously means growth if they can deliver valuable products to people affordably and delight them. And that's what a competitive market should do. It should be about offering better services and products to people. The insurance industry, with all due respect, has a long way to go, but this gives them an opportunity.
I'm really glad you brought that up, because I know you and others who worked on it originally have said that repeatedly, that, what happened in the Obama administration was essentially part one, and there needs to be a part two to continue the work. What's left to do? What needs to be done in order to really balance the scale, especially as we look at how it impacts health equity, how it impacted the pandemic? What do we need to do right now to better the ACA?
Well, our healthcare system is highly flawed, so there's always more to do. But I'll give you a great example. Today in Colorado, Governor Polis signed legislation which creates a standard benefit plan for people in the state that's more affordable with culturally competent networks. And those are all things: more affordable, culturally competent, which means more health equity, more affordable, and better networks that are all advances that people want. So those all address these issues.
Definitely. And moving on to your book, I know that you tweeted today that Trump's legacy was included basically trying to take away the ACA. And, in your book, you do mention that if it weren't for the stock market, if it weren't for the NBA halting its season, the death toll would be worse. And so I wonder, looking at it from that perspective, after being in the hot seat yourself, and you mentioned this in your book as well, that you had to take a moment to realize that you were now facing the exact same proposition. What surprised you the most about the way the public responded to the efforts that your team put in responding to the pandemic as part of the Biden administration?
Well, we had a very different job in the Biden administration. We had to vaccinate the country as quickly as possible with no inventory, not enough vaccines, public trust at an incredibly low level, and people exhausted from this whole pandemic. So, for us, that meant that we had to regain public trust, and we had to just execute by putting out more vaccinators, more vaccine locations, contracting for more vaccines, turning what was a 9-to-5 operation into 24/7 operation. People were frustrated that they weren't able to get vaccinated, and we just leveled with people. I remember going out in press conference and saying, we have a shortage. The shortage is going to last weeks. During that shortage, it's going to be very uncomfortable. but once the shortage is over, we're going to have an abundance of vaccines. And the public I think the feedback I got was people felt like, wow, this guy just told me the truth. And I'm not so sure I'm used to hearing just the truth, good or bad. I can deal with the truth. And so when things got better, people knew that things were actually better and we weren't just making things up.
You talk about that in your book, maintaining the sort of real life you, even as you take on the role of a government bureaucrat. But looking at it from that perspective and talking about how your team really focused on, low tech solutions and where to roll out, I think largely we saw that the public is comfortable looking at the healthcare industry largely by the private players. And we saw where that drop off on public health strategy happened and how it affected everything. So what do the learnings of this pandemic mean moving forward for the private sector, especially if we face another pandemic?
Well, look, I think with things like pandemics, the private sector cannot manage this on its own, and the public sector can't manage this on its own. What you need is a fully collaborative, cooperative effort led by the federal government. And when the federal government over the last year refused to lead, in fact, for a long time, refused to acknowledge the existence or the severity of the virus, it froze everybody. And there's very little the private sector can do in those situations. But that's so I think we have to make sure that we are willing to be in a position where we have leaders who are willing to make tough decisions. We pull the country together and unify. We don't use a pandemic to sow division, but we use it as a way to bring us together to support one another. And everybody has a role to play in that. On my first day in the Biden administration, I got calls from CEOs around the country, many of whom I think had been frustrated that they had wanted to help during the Trump administration, but because the president wouldn't acknowledge and wouldn't allow his team to acknowledge this was indeed a serious situation, they found that they had a very difficult time helping. We basically said anybody who wants to roll up their sleeves and scrub in, we will find a role for. In the private sector, many companies just did a remarkable job.
Absolutely. And moving forward, looking to the fall, I know there's still some concerns about what this pandemic is going to look like. You said in your book that at the beginning, we really looked as a society like people who had never seen fire before and who wouldn't believe it was dangerous without sticking our hands in it first. Have we learned as a society, as the U.S., as a country, how to respond to a pandemic, or are we still poorly prepared for the next one?
Well, there's two things that sort of signify the countries that did better in responding to COVID-19. One is very simply experience with public health crises before. So if you've never had a pandemic, and if you're a country like the U.S., which generally tends to think that we're kind of above the world's problems and those kinds of things don't happen here, it's no surprise that we were taken by surprise. And when you add to that we have some distrust of expertise. So when people telling us, hey, this is spreading asymptomatically, this is getting worse without us knowing, even if you can't see it, people had a tougher time here accepting that fact. And then the other thing that turns out to be an interesting factor in people's success is countries that are more egalitarian, as measured by how wide the spread is between the wealthy and the poor. Those with wide spreads like Brazil, the U.S., Russia, did much worse than countries where it's more egalitarian and where the spread is much lower, like Japan, like Denmark, like places like that. So this begs some questions about what kind of country we've become, what kind of country we are, whether we can unify, whether we have enough common cause, or whether we're all going to be just out for ourselves. And that makes it much harder to respond to a pandemic.
Certainly, we'll wait to see how things turn out, and we'll have to leave it there, but hopefully we'll have you again to discuss more. Andy Slavitt, former senior advisor to the White House for the COVID response team, as well as a former Obama CMS administrator and the author of Preventable. Thank you so much for joining us today.